Hi, I'm Dr. Sheppard with Align Family Wellness, and today we're going to be talking about torticollis. So, torticollis can be a stressful and troubling diagnosis for parents. It sometimes seems like a never-ending battle to work to get things not only back on track structurally, but also with their child's overall development. So, as pediatric chiropractors, we specialize in the care of these common infant challenges. And the one thing we want to tell you, so many of them are missed by the average pediatrician. So in this video, we're going to cover 4 main things you need to know about torticollis and even plagiocephaly. So we're going to include how to find out if your child has these challenges and what you can do to help. So with the rapid and significant rise in birth interventions and birth trauma, we see more and more cases of torticollis every year. Unfortunately, for most parents, traditional medicine has not updated their understanding of what's causing it and how to best care for it, leaving most families with traditional treatment options like physical therapy that sometimes don't get to the root cause of the problem. They are helpful, but sometimes there's more. So a lot of times it can affect their quality of life and they can struggle to hit milestones and suffer from ear infections. Mamas can be really desperate to find help. So what we're going to do is tell you how torticollis happens and what actually is the root cause. So torticollis is diagnosed medically as congenital if it's caused by abnormal positioning of the fetus while still in the womb. So, which is more common with things like breech position or low amniotic fluid. So the most common form of torticollis is what's called acquired, and its most common cause is birth trauma. So the amount of physical strain, tension, and pulling placed on the baby's neck and head during birth interventions like forceps delivery, vacuum extraction, C-section is pretty significant, and many times leaves the child with significant subluxation or stress stuck in the upper neck that can contribute to the torticollis itself. So subluxation has 3 main components. So it's number 1 is misalignment and abnormal positioning of spinal vertebrae. Number 2 is fixation and reduced range of motion in that segment and region of the subluxation. So their head and neck are usually kind of twisted to one side and they can't turn really well. A lot of times they have difficulty nursing on one side versus the other because they can't turn their head all the way. Number 3 is neurological interference and imbalance caused by reduced amount of proprioception and increased amount of nociception. So those are big words. Simply put, the more severe and apparent the torticollis and its related misalignment, the more severe the subluxation patterns are for that child. So why is even mild to moderate cases of torticollis missed most of the time? The first thing is that we'd encourage parents to do if they're concerned that their child may have torticollis is, of course, get another opinion. Pediatricians are trained to perform physical exams in such a way to spot neuromuscular challenges like torticollis, but they don't have the experience that a pediatric chiropractor or physical therapist would in actually determining the severity of it. So your pediatrician will most likely make a referral to a PT who will show the parents a few positioning and stretching exercises to do at home and help with the torticollis. But a lot of times parents tell us that those stretches and exercises that the kiddo's in pain and they don't want to be in those positions. They don't want to do the exercises. And so then the child gets all stressed out and they're in fight or flight mode all the time, which is what we're trying to avoid. So traditional treatment options such as physical therapy and helmets don't get to the root cause, which is the neurologic component. So if you put your baby in a helmet, it's going to help supposedly help their head shape, but it does nothing for the torticollis. So we have to work on, because the torticollis comes from the neck muscles and the upper neck, and they're putting that helmet on their actual head. So this is why parents report that when they put pediatric chiropractic as the foundation, as the first choice of their torticollis, it makes the physical therapy stretches much easier and much more effective. So we love to work hand in hand and work in conjunction with your child's therapy team, but we need to make sure we're addressing that subluxation and not just doing, a helmet and just being like, check back in a few months. So the pediatric chiropractic approach for caring for torticollis it makes sense. It can be summarized in 3 simple steps. We find the exact location and severity of that subluxation, and we can do that with our Insight Scan technology. We also make safe, such gentle adjustments to relieve that tension and remove the subluxation in the neck. And then we encourage parents to watch closely for reoccurrence of this torticollis around things like growth spurts, teething, colds, illness, or other stressful events that the child is going through. And we work with their PT or their OT and making sure that they're able to do their stretches and things more effectively. So as a pediatric chiropractor, we look deeper than any other practitioner using these insight scans to find and locate the exact stress and dysfunction of the neuromuscular system. So this is one of the real keys for caring for torticollis, not just the positioning and range of motion testing, but as pediatric chiropractors, we examine and evaluate kiddos under 5 who've had torticollis as an infant, and they did all these therapies and they still have this retained torticollis years later, and it's found on our insight scans during their neurologic evaluation. So in many cases, parents start to see results and see their kid experience relief in just a few weeks. And it takes a few weeks or even a few months to get full resolution of the torticollis, even with a team effort. So before we get started, we'll sit down with you and we'll go over the report of findings. We'll show you the scans. We'll make a personalized care plan just for your kiddo and tell you what exactly that entails. There's really no cookie cutter approach to torticollis where each kid gets the same stretches and positioning. The exam and the scan is crucial to make sure we find the exact root cause of your child's challenges, and we make the right specific adjustments to that spot. So if your mom or dad gets telling you there's more going on and you want a little bit more help than what your pediatrician or your therapist is actually giving you or explained, neurologically focused chiropractic care is perfect for you. We specialize in diving deeper and doing a more thorough assessment than anybody else out there does, making sure we get to the true root cause of torticollis. So if you have questions or if you're concerned that your kiddo may still have some torticollis or is really struggling with nursing issues or tummy time, give us a call. We would love to take care of you. We'd love to scan your kiddo. We'd love to take a look there. They can be scanned as early as a newborn. We've got lots of resources for you. So if you want more information, you can comment below or send us a DM, and we would love to care for you and your kiddo.